Do you find that the patient is more compliant with understanding nutrition and may even like their experience with you may even lead to a little bit of a life change in terms of how they treat their body?
Very well said. Yeah. And I love that part of it. And some of my other patient stories definitely get into those things that have very little to nothing to do with their results from their procedure with me, but a lot to do with like changing their blood glucose path that they were on from an insulin resistant standpoint, like finding out like you're really quite insulin resistant and, putting them on a continuous glucose monitor in their time leading into their procedure and then them getting a sense of, what that does for them. And I love those parts of it, and it's funny. I kind of tease some of those patients when I see them in follow up when they're, they've lost weight at that point or whatever it may be. And my blood glucose is under control and I'm not insulin. And I'm like, and we're celebrating that. And I'm like, well, look at your result too. It's so good,
Yeah.
And so kind of always a little funny joke about these different parts of it. But I think there's a bit of a selection bias, meaning that the people that are coming to me may already have sort of a predisposition to be interested in these things,
Right.
which is how they're finding me a lot in the first place. They're just resonating with my message. You have to have a surgeon, especially in a situation like this, that you resonate with.